Is Tylenol safe in pregnancy? And Matcha, is it worth the hype? And how can you really protect your brain health? Welcome to another solo episode. And in this deep dive episode, we're tackling 3 hot topics in health and science. I'm Dr. Karan, and in this podcast, we'll be covering lots of science-based actionables that you can apply to your daily life and separate the fact from the fiction when it comes to health. First off, we're going to be covering Tylenol, or acetaminophen/paracetamol use in pregnancy, and this controversial recent link that's been promoted by Donald Trump with autism. And we're going to be separating the controversy from the facts. And everyone seems to be obsessed with Matcha, and again, I want to separate the hype versus the actual health benefits and how it compares to coffee, which is my personal favorite. And finally, it's worth looking at a topic which should be the priority for many more of us than actually is. That's brain health and dementia prevention, evidence-based strategies, and what really matters for your mind. In each segment, we'll cut through the noise with a nuanced look at what research actually shows, where the gaps are, and what actionable steps we can take. So let's dive in. All right, the first very juicy and very controversial topic, Tylenol during pregnancy. Let's look at the controversy versus the actual evidence. First of all, let's set the stage. Recently, in the last couple of weeks, an unusual health controversy made headlines in the US. Even the White House got involved. President Donald Trump publicly warned pregnant women to avoid Tylenol, that's also known as acetaminophen, claiming that it could cause autism in their children. He went so far as to tell expectant mothers to tough it out rather than take the popular pain reliever. And this came alongside calls to revisit discredited theories linking vaccines to autism, leaving doctors and scientists dumbfounded. A lot of health experts immediately pushed back. The American College of Obstetricians and Gynecologists, ACOG, the American Academy of Pediatrics, and numerous research and autism advocacy groups denounced these claims. And you might be thinking, why? That's because decades of medical guidance and a large body of research have found acetaminophen to be the safest first-line pain and fever reducer during pregnancy when used as directed. In fact, even Britain's Medicines and Healthcare Products Regulatory Agency, the MHRA, swiftly reiterated that there is no evidence that taking paracetamol or acetaminophen during pregnancy causes autism in children. And numerous guidelines and authorities continue to recommend acetaminophen as the first choice analgesic for pregnant women, with the caveat to use the lowest effective dose for the shortest necessary duration. And this use the minimum necessary advice isn't because of known long-term harms, it's just standard prudent practice for any medication in pregnancy. So if the medical consensus says that Tylenol is generally safe in pregnancy, what sparked this scare? Now, it turns out the frenzy stemmed largely from a single scientific review published in 2025. That review applied an environmental health evidence grading method known as the Navigation Guide, and it concluded that there was an association between prenatal acetaminophen and neurodevelopmental disorders like autism and ADHD. The authors went so far as to urge immediate steps to limit acetaminophen use amongst expecting mothers, and surprisingly this paper made waves and it gave a seemingly scientific backbone to lawsuits and alarmist headlines. However, I must point out that this review is an outlier and has some major red flags. And we can flag multiple methodological flaws in this review. Now, this review pulled 46 observational studies, many of which relied on mothers' self-reported acetaminophen use long after the fact. Relying on memory alone introduces something known as recall bias. A mum whose child later develops a disorder might more easily remember or assume she took a medication than a mum of a child without any issues. And this can inflate apparent links, and many studies in the review lacked precise data on dosage and duration of Tylenol use. Without knowing how much and how often the drug was used, you can't establish a dose-response relationship. For example, did heavy, prolonged use matter more than 1 or 2 doses? We don't know from that data. So this makes causal claims scientifically unfounded. The studies also use inconsistent outcome measures for child neurodevelopment, combining different ways of diagnosing or assessing autism and ADHD across the studies. Mixing apples and oranges like that can yield misleading results that don't reflect a true biological relationship. And confounding factors were not adequately controlled in most of those studies, and this is critical. Families differ in genetics and environment. For example, underlying maternal health conditions, infections, inflammation, pain that prompted Tylenol use could themselves be related to neurodevelopmental differences in children. If you don't fully account for such third factors or confounders, you might falsely blame Tylenol. Notably, genetics plays a huge role in autism risk, and genetics are obviously shared within families. Many studies the review included simply couldn't separate genetic predispositions or other environmental factors from the medication issue. And one glaring disclosure, the senior author of that 2025 review had served as a paid expert witness for plaintiffs in acetaminophen litigation, and a court had actually rejected his testimony as scientifically unfounded. Now, this doesn't automatically invalidate the research, but it raises concerns about objectivity. Now, contrast that contested review with the strongest studies we have to date. In April 2024, a comprehensive Swedish study was published in JAMA that tracked 2.48 million children born from 1995 to 2019. Crucially, this study included a sibling comparison analysis, meaning they looked at families where one sibling was exposed to acetaminophen in utero and another was not. Siblings obviously share genetics and household environment, so they're highly useful for controlling confounders. And the results in this study, when comparing children to their own siblings, there was no increased risk of autism, ADHD, or intellectual disability in those exposed to acetaminophen during pregnancy. All the hazard ratios hovered around 1.0, which means no effect. For autism, the hazard ratio is around 0.98, and for ADHD, around 0.98 as well, intellectual disability, around 1.01. In other words, any slight associations seen in simpler models vanished after accounting for family factors. The researchers concluded that prenatal acetaminophen is not a cause of these neurodevelopmental disorders, and prior correlations were likely due to confounding factors. This JAMA study is widely considered the most robust to date on this topic, given its huge sample and rigorous design. Similarly, a large Japanese study of 100,000 to 200,000 children also used sibling comparisons and found no link between acetaminophen use in pregnancy and autism. And this simply reinforces the Swedish findings in a different population. Now, the upshot is the best current evidence does not support the idea that normal use of Tylenol in pregnancy causes autism or any other neurodevelopmental issues. Autism spectrum disorder is a complex, multifactorial condition with a strong genetic basis, and it cannot be reduced to a single over-the-counter medicine exposure. Blaming autism on something like Tylenol is as scientifically unfounded as blaming it on ice cream consumption. And that's simply referencing confounding variables. Now, why then did the FDA issue an alert? Indeed, the FDA in September 2025 did announce it would revisit acetaminophen labels to mention the inconclusive data about neurological outcomes. The FDA cited a couple of cohort studies and essentially said some studies suggest a possible link, but a causal relationship has not been established. They advised clinicians to consider telling patients to minimize use for routine, mild fevers, i.e., don't pop Tylenol for trivial reasons. Notably, acetaminophen remains the only recommended over-the-counter fever reducer during pregnancy in the US, precisely because untreated high fever is a known danger to a developing fetus, and we'll get to that in a bit. And alternatives like ibuprofen are contraindicated in most of pregnancy, and that just means it's highly advised against in most cases. In effect, the FDA took a precautionary stance in wording but did not ban or formally restrict the drug, and many experts felt that even this alert was an overabundance of caution, likely spurred by political pressure rather than new science. In response, the World Health Organization quickly issued a statement reassuring that extensive research over the past decade had found no consistent evidence linking acetaminophen in pregnancy to autism or ADHD. Now, why is acetaminophen still recommended during pregnancy? And that's because untreated pain and fever carry their own risks. High fever, especially in the first trimester, is a well-established risk factor for certain birth defects like neural tube defects and miscarriage. Fever and infection-related inflammation in the mother have also been linked to a higher risk of neurodevelopmental problems in the offspring. Ironically, not treating a fever might pose more risk to the baby's brain than medication doses. Additionally, for pain relief, acetaminophen is favored because alternatives are worse. Non-steroidal anti-inflammatory drugs, NSAIDs like ibuprofen, can cause issues such as premature closure of the vital fetal blood vessels, which is known as ductus arteriosus, if used in late pregnancy, and possibly increase the risk of miscarriage or cause kidney problems when used earlier in pregnancy. Opioid painkillers, of course, carry risk of dependence and neonatal withdrawal, so acetaminophen is the mildest and safest option we have for pregnant women. Now, what I really want to highlight here is the real scandal. The real issue here is not that women have been taking acetaminophen, it's that we have a persistent lack of high-quality research on medication use in pregnancy. For decades, pregnant women have been systematically excluded from clinical trials out of an understandable desire to protect fetuses from experimental risk. But this means we often lack the kind of gold standard data we'd like for medications in pregnancy. In that void, gaps get filled by loud voices and misinformation. It's telling that it took observational studies of millions of pregnancies to finally give clearer answers, because running a randomized controlled trial for something like this is practically and ethically quite hard. I mean, there are ways to ethically study drugs in pregnancy. For example, carefully designed registries, non-interventional cohort studies, and yes, perhaps trials in certain circumstances with consent. But such research has historically been underfunded and deprioritized. Women often have to make decisions in pregnancy based on limited evidence. So moving forward, the hope is for more rigorous studies focusing on medications and health needs in pregnancy so that decisions can be based on solid evidence rather than fear. Now, the take-home message here is that if you are pregnant or planning to be and wondering about Tylenol, the current medical consensus is reassuring. Use it if you truly need it, but as always, use the lowest effective dose for the shortest time. Treating a fever or a bad headache is important for your health and your baby's health. Don't suffer in silence due to sensational headlines. Of course, always consult your healthcare provider about any medications in pregnancy, because they can help to weigh the risks and benefits for your specific situation. And remember, the claims that Tylenol causes autism are not supported by the most robust evidence. In fact, framing autism as the result of a mother's choice of painkiller is not only scientifically unfounded, it's harmful. It fuels stigma against autistic individuals and needles mothers with unnecessary guilt. Autism has zero to do with something you took for a fever. It's far more complex, with genetics playing a big role, so don't let internet rumors or political sound bites override the advice of medical professionals who have your and your baby's best interests in mind. Now, we've seen how important it is to base health decisions on solid evidence, not hype. Now, speaking of hype, let's switch gears a little bit from medicine to nutrition and a green powder, not the one you're thinking of, that's been generating a lot of buzz lately. No, it's not green vitamin powders, it is matcha. Is it a health elixir or is it just hype? Matcha lattes, matcha smoothies, matcha everything. The vibrant green tea powder has taken the wellness world by storm, and it's often touted as a superior alternative to coffee, promising calmer energy and a treasure trove of antioxidants. But I've been wondering, and probably you have as well, how much of this is marketing versus reality? Let's explore what matcha actually is, its potential benefits, and some caveats so you can judge whether it's worth the often hefty price tag. Now, what is matcha exactly? Matcha is a type of green tea made from finely ground whole tea leaves, Camellia sinensis. Unlike regular green tea where you steep the tea leaves and then discard them, with matcha, you consume the entire leaf in powdered form, whisked into liquid. This means you're getting a more concentrated dose of the tea's components. Matcha originated in Japan and was traditionally used in Zen Buddhist tea ceremonies, but these days it's gone thoroughly mainstream. And you'll find matcha shots, desserts, and lattes in cafes worldwide. Now, one of the big selling points of matcha is that it provides a gentle, focused energy boost rather than the jittery jolt often associated with coffee. Now, you might be wondering how that's the case. Now, first, matcha does contain caffeine, roughly 70 milligrams per cup. The exact amount varies with preparation and powder amount. Now, compare this with around 95 to 100 milligrams of caffeine in a typical cup of coffee. So it's a bit less caffeinated than coffee, but still enough to be noticeable. What really sets matcha apart is that it's rich in an amino acid called L-theanine. L-theanine is unique to tea, especially green tea, and crosses the blood-brain barrier where it has calming effects, promoting relaxation and reducing anxiety without causing drowsiness. When you combine L-theanine with caffeine, interesting things happen. Research indicates that this combination can lead to improved attention and alertness compared to caffeine alone. Essentially, the L-theanine tempers the harsh edges of caffeine. Subjectively, many people report that matcha gives them more steady or zen focus, and that comes without the spikes and crashes that coffee can often bring. In EEG studies, basically checking your brain electricity maps, L-theanine increases alpha brainwave activity, often associated with a relaxed yet alert mental state. So the hype about a calmer buzz has some truth behind it. Matcha naturally pairs a stimulant, caffeine, with a tranquilizer, L-theanine, in one package, all of which can yield potentially a smoother energy uplift. Of course, individual responses will likely vary, and some folks are just very sensitive to caffeine regardless, and others might not notice a huge difference. So if coffee gives you the jitters, it might be worth lowering the dose or even trying matcha just for a different vibe. Now let's take a look at the antioxidants and polyphenols. Like regular green tea, matcha is loaded with polyphenols, which are plant compounds with antioxidant properties. In fact, because you ingest the whole leaf, you may get more of these compounds. About 30% of matcha's dry weight is made up of polyphenols, and the majority of those, around 90%, are a subclass called catechins, the most famous catechin being EGCG, epigallocatechin gallate. These catechins are like little fire extinguishers for oxidative stress. They can neutralize free radicals that damage your cells, and some laboratory and animal research suggests that catechins have anti-inflammatory effects, support metabolic health like modestly helping blood sugar and cholesterol, and even have anti-cancer potential. I will add that human studies on green tea, not just matcha specifically, have linked higher consumption to subtle improvements in cardiovascular risk factors. For example, slightly lower LDL or bad cholesterol and blood pressure in habitual tea drinkers, as well as a lower risk of certain diseases when consumed regularly over time. And by drinking the matcha powder, you also get components that wouldn't fully extract in a brief brew. For instance, some of the fiber from tea leaves. A teaspoon of matcha powder can deliver around 1 to 2 grams of dietary fiber, and mostly the insoluble fiber from the leaf cell walls. It's roughly the fiber content of a cup of raw spinach in just 1 cup of tea. And again, given most of us fall short of fiber, every little helps. And that insoluble fiber from the matcha can help to keep things moving through your gut and may provide a tiny boost to your gut microbiome, since your gut bugs do love fiber, but you should probably focus more on the soluble kind. Nutrient-wise, matcha also contains vitamins and minerals like vitamin C, small amounts of beta-carotene, vitamin K, etc. Though not in miracle quantities given these small serving sizes, it is really the catechins and L-theanine that shine. Now, we have discussed the immediate cognitive effects like focus and alertness from caffeine plus theanine, but what about the long-term brain health benefits? Now, there is some epidemiological evidence, mostly for green tea in general, that it could support cognitive health with aging. For instance, a large 2025 study in Japan of 8,700 plus older adults found that those who drank more green tea had fewer white matter lesions on their brain MRIs. White matter lesions are essentially little spots in the brain that indicate small vessel disease. They're linked to memory problems and a higher dementia risk. In that study, the people who drank 3 or more cups of green tea daily had the lowest burden of these lesions. Interestingly, coffee consumption in that particular study didn't correlate with differences in brain lesions. The thought is that antioxidants in green tea might improve blood vessel health or reduce inflammation, thereby protecting the brain's tiny blood vessels from damage. Now, I must remind you, this is associative data. It doesn't prove causation, but it aligns with other research hinting that regular tea drinkers have a slightly lower risk of cognitive decline compared to non-drinkers. It's worth noting that most of these studies didn't specifically use matcha, just green tea or tea in general, but since matcha is basically a potent form of green tea, it likely confers similar benefits. There's also preliminary research suggesting green tea extracts might reduce amyloid plaque formation implicated in Alzheimer's in animal models, but that's far from clinical advice. So promising, but not definitive in the verdict on tea and brain aging. Now, one angle you might not hear as often is how matcha affects your gut microbiome. This is an emerging area of study, and a randomized controlled trial in 2022 in healthy Japanese adults looked at matcha's impact on gut bacteria. The participants drank matcha tea twice a day for 2 weeks, and researchers compared their before and after microbiome profiles versus a placebo tea group. Amazingly, just that short intervention led to significant shifts in gut bacteria composition. In the matcha group, they observed an increase in beneficial strains like Coprococcus and a decrease in potentially problematic ones like Fusobacterium. Coprococcus bacteria are generally associated with producing butyrate, a fatty acid that nourishes the gut lining and has anti-inflammatory effects. Fusobacterium, on the other hand, includes species that in excess have been linked to gut issues, so these changes suggest a tilt towards a healthier gut environment. The author speculated that matcha's catechins may act as prebiotics, which is fuel for good bacteria, or directly inhibit the growth of undesirable microbes, and that the small amount of insoluble fiber in matcha would contribute too. While 2 weeks is short and we should be cautious extrapolating that, it's a cool finding. It means what you drink can alter your gut flora pretty quickly. Coffee, by the way, has shown similar microbiome benefits, and more on that in a moment. For matcha specifically, more research is needed to see if these gut changes persist and have tangible health effects. And an important question to ask here is matcha healthier than coffee? This is a common question, and it's often framed in trendy articles as an either-or superiority contest. And the truth is, both coffee and tea, including matcha, have health benefits, they're just different. Coffee typically has more caffeine per cup, so it's better if you want a stronger wake-up jolt or improved athletic performance. And coffee is also a rich source of antioxidants, notably chlorogenic acids, which have been studied extensively. Large epidemiological studies and meta-analysis have consistently linked moderate coffee consumption with a lower risk of several diseases, including type 2 diabetes, Parkinson's, liver diseases like liver cancer, and cirrhosis, and even overall mortality. For instance, meta-analyses show that coffee drinkers tend to have a modestly lower risk of heart disease and certain cancers compared to non-drinkers. Some research suggests that coffee may help to protect against dementia as well. One umbrella review concluded that drinking over 3 cups of coffee a day was associated with a lower risk of dementia and Alzheimer's. Though one should balance that with the potential downsides of high caffeine for some people. Importantly, many of coffee's benefits are seen with black coffee or minimal sugar and dairy. Once you start adding 5 pumps of syrup and whipped cream, it's a different story for health. Coffee is also being recognized as good for the gut. Regular coffee consumption has been associated with a greater gut microbiome diversity and a higher level of beneficial bacteria. A study in Nature Microbiology in 2025 identified that coffee drinkers had higher levels of a microbe called Leucinobacter that's linked to antioxidant activity. And generally, polyphenols in coffee have a prebiotic effect, meaning they feed friendly gut bacteria. And fun fact, coffee even contains a small amount of soluble fiber, and by some estimates, drip coffee provides a couple of grams of fiber per cup. All of these factors could explain why coffee drinkers often have regular bowel movements beyond caffeine's laxative effect. Now, hype versus reality. It's important to slice through the marketing. Is matcha a miracle superfood that will detox you and cure all ills? No. It's a nutritious beverage, not an elixir of immortality. And some claims out there, like it boosts metabolism for weight loss or detoxifies heavy metals from your body, are exaggerated and not backed up by any solid evidence. So if you swap a frappuccino for a matcha latte, you probably made a slightly healthier choice, mainly because you likely cut out a ton of sugar and fat. But that's not magic, that's just common sense because it's less sugary junk. Matcha alone isn't going to overhaul your health unless it's part of an overall balanced diet and lifestyle. Also, on that note, many coffee shops that give you matcha drinks do contain a lot of sugar. Some matcha powders are pre-sweetened and many coffee chains add syrup. So if you want the health benefits, opt for unsweetened matcha or lightly sweeten it yourself. The traditional way is in water, which can be an acquired taste because it's quite vegetal. Now let's talk about the quality and grades of matcha. You might have seen ceremonial grade versus culinary grade matcha, and simply, ceremonial grade is made from younger tea leaves, prized for a smooth, delicate flavor and bright green color, ideal for drinking straight. And culinary or premium grade uses slightly older leaves, has a more bitter, robust flavor and a duller green hue, and it's intended for mixing into recipes or lattes. Interestingly, the cheaper culinary grade contains a higher level of some antioxidants than the pricier ceremonial grade, around 30% more catechins according to some tests. And that's likely because older leaves accumulate more polyphenols and also more bitterness. Now, a word of caution about matcha in excess. Iron absorption. One often overlooked aspect of tea and coffee drinking is that their polyphenols can inhibit iron absorption. The compounds in tea, especially tannins and catechins, can bind to iron in the digestive tract, reducing how much of it your body takes up. This mostly affects non-heme iron, the kind you get from plant foods like beans, greens, and fortified grains. For most people with balanced diets, enjoying tea or coffee in moderation isn't going to cause anemia. But if you are a person with borderline iron levels already, say a menstruating woman with heavy cycles or someone with an iron-poor diet or certain conditions, chugging matcha or tea all day, especially around meal times, could potentially make it harder to keep your iron up. There have been case reports of iron deficiency anemia linked to excessive green tea drinking. For instance, one report noted severe anemia in a person who was drinking an extremely high volume of green tea daily, and the tea's polyphenols were thought to be a major factor. The good news is that simply spacing your tea intake away from iron-rich meals and adding some vitamin C like lemon when you have tea can counteract that effect, because vitamin C greatly enhances iron absorption and can offset the inhibitors. Also, if you eat meat, which is a source of heme iron, that form isn't blocked by tea. So, practical tip, if you're a big matcha or tea drinker and you have issues with low iron, consider taking your tea an hour or two between meals rather than with your food, and ensure you get vitamin C and, if needed, iron-rich foods or supplements in your diet. Everything in moderation, balance your green tea love with attention to your overall nutrition. Now, enough about matcha. So far, we've talked about 2 specific items, a medication and a beverage, and we saw how important it is to find balanced evidence-based views. Now, for our final segment, let's zoom out a little bit and talk about brain health in general. Given all the news about dementia on the rise, what can we actually do in our daily lives to keep our brains healthy? Now, nearly everyone, in fact, everyone has some skin in the game, whether it's fearing cognitive decline for ourselves as we age or seeing a loved one struggle with dementia. Brain health is a topic close to heart. And the good news is there's a large body of research suggesting that lifestyle factors significantly influence our brain's destiny. We may not be able to change our age or our genes to the biggest risk factors for dementia, but there are many modifiable factors we can address. In fact, the latest Lancet Commission report in 2024 on dementia prevention estimates that between 40 and 45% of dementia cases could be prevented or delayed by targeting certain risk factors across lifespan. That's huge. Nearly half of cases theoretically are attributable to factors we might improve. It means even small changes, if made population-wide, could reduce dementia prevalence by millions of cases. So, what are these factors and what actionable steps can we take? Let's break it down. Now, the research, especially the Lancet Commission in 2020 and its 2024 update, has highlighted 12 to 14 key risk factors to focus on. First of all, less education in early life. Not attaining at least a secondary school level of education is associated with higher dementia risk. Education is thought to build cognitive reserve, giving your brain more resilience. Actionable insight: obviously you can't time travel to change your childhood schooling, but the concept of cognitive reserve extends to adulthood. Keep learning new things throughout life. Engaging in mentally stimulating activities, reading, learning new languages or new skills, even in mid and late life, might help to bolster your brain's network. Essentially, never stop learning. Your brain loves the challenge. Next is hearing loss in midlife. This has emerged as a major risk factor. Untreated hearing loss in midlife, 40s, 50s, and early 60s, is linked to increased dementia risk later. The theory is that hearing impairment can lead to social isolation and less auditory stimulation to the brain, or possibly direct neurobiological changes from strain. The actionable insight here would be protect your hearing, especially using earplugs in loud environments, avoiding chronic exposure to high noise, and if you're experiencing hearing loss, don't tough it out. Get a hearing aid if recommended. Modern hearing aids are very effective, and evidence suggests that using them may reduce dementia risk back down to baseline in those with hearing loss, presumably by keeping the brain engaged in communication. Treating hearing loss is one of the easiest wins in dementia prevention, in my opinion, because it's a fixable sensory input issue. Now moving on to traumatic brain injury in midlife. Head injuries that cause concussion or worse are linked to higher rates of dementia, for example in former boxers or football or soccer players, or even a history of serious accidents. Actionable insight: you can't always avoid accidents, but wear your seatbelt, use helmets for biking or high-risk sports, fall-proof your home as you get older, basically protect that bone dome. And obviously, it goes without saying, avoid unnecessary head trauma. If you have jobs or sports with high head injury risk, take precautions to minimize repeated impacts. Now, this next topic is very underreported: hypertension in midlife. High blood pressure in midlife is very strongly linked to cognitive decline and dementia, especially vascular dementia, but also Alzheimer's. Your brain's blood vessels are delicate. Years of hypertension or high blood pressure damage can ruin them and cause tiny strokes and white matter damage. Now, a key practical tip here is know your blood pressure numbers. If it's high, take steps to control it. Lifestyle changes, reducing salt, eating more fruits and veg, maintaining healthy weight, exercising regularly, managing stress, and or medications as needed. Do not ignore hypertension because often it has no symptoms. It's silently affecting your brain and heart. And treating blood pressure is proven to reduce a risk of strokes, and there's evidence it lowers dementia risk too. In fact, a trial known as the Sprint Mind trial showed that aggressive blood pressure control led to fewer cases of mild cognitive impairment. The next risk factor is obesity in midlife. Midlife obesity, typically measured by BMI or waist circumference in one's 50s and 40s, is associated with higher dementia risk. Obesity often correlates with other factors like inactivity, diabetes, and vascular issues, which can together cause harm to the brain. Now, it sounds like boring advice, but maintaining a healthy weight through diet and exercise, especially in midlife, is very important for dementia risk prevention. It's not just a number on a scale, but rather keeping metabolic and vascular health in check. Central obesity, which is the belly fat, is in particular linked to brain atrophy, likely due to inflammation from the visceral fat and the blood sugar effects it has. The next risk factor is very obvious: smoking, especially in later life. Smoking has a clear dose-dependent relationship with dementia. It causes inflammation and oxidative stress and wreaks havoc on blood vessels and increases your stroke risk and maybe directly harms neurons. It goes without saying, if you are smoking, you should quit, or better yet, don't start. It is never too late. Quitting even in one's 60s can improve cardiovascular health and likely reduces risk of cognitive decline versus continuing to smoke. And if you need help, there are programs, nicotine replacement meds, talk to a doctor. Your brain and lungs and heart will especially thank you. Now let's talk about alcohol, particularly excessive use, especially in midlife. Heavy drinking, generally a regular consumption far above the recommended limits, increases dementia risk. It can lead to alcohol-related dementia and also raises blood pressure and causes other sorts of health harms. Current guidelines often say up to 1 standard drink per day for women and 1 to 2 for men is moderate, and anything beyond that, especially binge drinking, is bad news for your brain. And my personal take is that any amount of alcohol at whatever dose will contribute to brain risk. It might be a hard line, but that is what the science says. Now, if you do like an occasional drink in moderation and you've got all these other lifestyle factors dialed in, then it's probably okay. But if you want to lean on the best scientific evidence, teetotal is best. Another risk factor is depression, particularly in later life. A history of depression, particularly in those later years, is associated with a higher dementia incidence. And this could be because depression is an early symptom, in some cases dementia, or because chronic depression effects like elevated stress hormones, inflammation, and less social engagement might contribute to cognitive decline. Now, the actionable insight here is a bit complex, but ultimately, take care of your mental health. Don't hesitate to treat depression via therapy, medications, social support, talking therapy, exercise, all of these things, or a combination of these things, whatever you can do to help with your mood. All these can improve quality of life and potentially even protect cognition indirectly. And there's evidence that treating depression can improve cognitive function, and at the very least, it keeps you engaged in life, which is important for the brain. Another underrated factor is social isolation, especially in later life. Loneliness and the low social contact in older adults correlate with higher risks of dementia. Humans are social creatures. You've heard that line trotted out time and time again. Interacting with others keeps the brain active and may provide emotional support that reduces stress. So make sure you prioritize friendships, family time, community activities, or even volunteering. If mobility is an issue for you, even phone calls or video chats can help. Join clubs, religious groups, take classes, anything that maintains your social networks and sense of connection. Conversely, if you notice an older loved one withdrawing socially, try to engage with them. It's not just about loneliness, it could impact their cognitive trajectory. And this is an obvious one, but worth mentioning: physical activity, especially in later life. Sedentary lifestyles is a known risk factor for many chronic diseases and is linked to cognitive decline too. Exercise benefits the brain by improving blood flow, reducing inflammation, stimulating growth factors that help neurons. So move your body as much as you can. If you can, try to aim for at least 150 minutes of moderate exercise a week, and brisk walking counts. And if you can throw in some strength training too a couple of times a week, that is amazing. And if you're in midlife or younger life now, build that exercise habit now and carry it forward. It is truly one of the best brain drugs we have. Another underrated risk factor is diabetes. Type 2 diabetes, especially if poorly controlled, significantly ups the risk for dementia, both Alzheimer's and vascular types. High blood sugar and insulin resistance can damage blood vessels and neurons. So if you're pre-diabetic or diabetic, follow guidelines for a healthy diet, low in refined carbs, appropriate calories, etc., and exercise to maintain good insulin sensitivity. There is evidence that in diabetics, tighter glucose control is associated with better cognitive outcomes than uncontrolled diabetes. Essentially, what's good for your blood sugar is good for your brain. Air pollution. Now, this one is tougher on an individual level, but studies have linked living in highly polluted areas with fine particulate matter in air to higher dementia rates. Air pollution can cause systemic inflammation and affect the brain. The actionable insight is, while we need policy-level change for cleaner air, you can take small steps. Avoid heavy traffic pollution when exercising outdoors, for example, choosing a park over a busy street, and consider an air purifier at home if you live in a polluted city, and support clean air initiatives. It might also be worth wearing a mask on very smoggy days if you're in an urban area. It's not definitive for brain health, but it can help the lungs, which might reduce particulate inhalation. Newly added risk factors for 2024 include vision impairment, like hearing. Untreated poor vision, like not correcting cataracts or wearing needed glasses, is now recognized as a risk factor. So go get your eyes checked regularly, use glasses or contacts if prescribed, and address cataracts or other reversible vision issues. It's often a quick outpatient surgery to fix cataracts, which not only improves quality of life, but could help keep your brain sharp by allowing you to continue reading, driving, and interacting with the world. Another newly added risk factor was high LDL cholesterol. High levels of bad cholesterol in midlife have been implicated as a contributing factor, likely because they reflect your vascular risk. Make sure you manage your cholesterol and regularly check it and your heart health and your triglyceride panels. This overlaps with diet, exercise, and weight management. Eat heart-healthy fats like those found in nuts, fish, olive oil instead of saturated trans fats. And if your LDL level is very high, discuss with a doctor. Now that's a lot of factors, but notice a pattern. What's generally good for the heart tends to be good for the brain. Many of these risk factors like blood pressure, diabetes, cholesterol, smoking, obesity, exercise are classic cardiovascular health factors. And that's no coincidence. The brain's health is heavily influenced by blood flow and vascular integrity. In fact, some experts even use the slogan, protect the heart equals protect the brain. Now, it might seem overwhelming to tackle so many areas. However, a lot of these factors cluster together and have shared solutions. For example, if you exercise regularly, you help control weight, blood pressure, cholesterol, and blood sugar, and you improve mood and you address that depression. And you might do it socially, and that addresses isolation. Likewise, eating a healthy diet like a Mediterranean diet can help with weight, diabetes, cholesterol, and possibly provides antioxidants that reduce inflammation in the brain. Sleep is another lifestyle factor garnering attention. Chronic poor sleep or sleep disorders in midlife are associated with cognitive problems later. When we sleep, our brain clears waste products, including amyloid beta, which is implicated in Alzheimer's via the glymphatic system. So consistently inadequate sleep might hamper that clearance. And clearly, you should listen to that advice of aiming for 7 to 8 hours of quality sleep per night. Treat insomnia or any sleep apnea if you have them. Make sure you look at your sleep hygiene. Are you sleeping in a dark, cool room? Do you have a regular schedule? Are you limiting alcohol or removing alcohol, which fragments sleep? And are you avoiding heavy meals or screens before bed? Your brain needs that nightly cleaning routine and memory consolidation time. Now, you might wonder, do these lifestyle changes really make a difference, or is it just observational hope? There have been some randomized trials testing multi-factor interventions in people at risk of cognitive decline. The most famous is the finger trial in Finland. In this study, over 1,200 adults, 60 to 77 years old, at risk for dementia were assigned to either a control, which is general health advice, or a 2-year intensive lifestyle intervention group. The intervention combined many elements: nutritional guidance, exercise, cognitive training, social activities, and management of metabolic vascular risk factors. After 2 years, the intervention group showed significantly better cognitive performance than the control. In fact, the overall cognitive scores improved by 25% more than the control group scores. Additionally, the intervention folks had improvements in physical health and quality of life, and notably, even people with a genetic risk, the ApoE4 gene, benefited as well. This was a landmark proof that it's never too late to improve brain outcomes through lifestyle. So if you want a protocol for brain health, think of it as living a heart-healthy, socially engaged, mentally active life. It's wonderfully holistic, benefiting not just the brain, but the whole you. One thing to note, however, these lifestyle measures reduce risk, but they don't guarantee prevention. They sort of stack the odds in your favor. You could do everything right and still develop dementia, unfortunately. Age and genetics are powerful. But by following these strategies, you increase your chances of delaying the onset or reducing the severity of cognitive decline. And even if dementia were to occur, people who had higher cognitive reserve from education or a stimulating life often maintain function longer despite brain changes. So you literally have nothing to lose and everything to gain in adopting these healthy habits. And another encouraging point, the brain is more plastic than we used to think. It can form new connections and even new neurons to a limited degree in response to learning and exercise even in older age. So we're not helpless bystanders, our brains respond to how we live. Now, from Tylenol in pregnancy to matcha lattes to protecting our aging brains, we've journeyed through a spectrum of health topics today, and a common theme is the importance of nuance and evidence. We saw that sensational claims, whether it's Tylenol causes autism or matcha will solve all your problems, should be met with healthy skepticism and examined in the light of solid research. Above all, science is an evolving story, and staying informed with the latest high-quality evidence is key. I hope this discussion empowers you with the knowledge to make mindful choices, whether it's not falling for fear-based misinformation or embracing daily habits that nurture your well-being. Small steps done consistently can yield remarkable outcomes over time. Thank you for listening. Stay curious, stay critical, and take care of your health, both body and brain. If you want me to cover specific topics, drop a comment below. Until next time, stay well and keep learning.